I'm Sabrina, as was mentioned earlier. I am an MS4 at the College of Medicine, and I'm here to talk to you guys today about the Physicians for Human Rights Asylum Clinic that we have here. So to start off, what is Physicians for Human Rights? No, you can go to the next slide. So it is a nonprofit organization that plays a unique role in the field of human rights by mobilizing health professionals worldwide to address critical issues. So they leverage the power of medicine, science, and research to document human rights abuses such as torture, mass atrocities, attacks on healthcare workers during war crimes, and violence against marginalized populations. So one of the core ways that PHR makes an impact is through advocacy. They push for justice and accountability, often focusing on policy changes that can make long-term difference. This often means working in high-stakes environments, including conflict zones, where they partner closely with legal and humanitarian organizations to strengthen their impact. Their ultimate goal is not only to prevent human rights violations, but also to ensure that people affected by war, persecution, and systemic injustices have better access to healthcare and support. And their work provides a bridge between the worlds of health and human rights, showing how they both intersect to create meaningful changes. So we can go to the next slide. So when did Downstate get involved with PHR? Well, Dr. Grant, our faculty advisor, he's a professor of neurology and director of the epilepsy clinic here at Downstate. His journey with Physicians for Human Rights began back in 1990 when he was still a medical student. And since then, he's been deeply involved, particularly in areas like prison medicine and the physician asylum network. So he does a lot of training. And over the years, he's examined asylum applicants from more than 20 different countries and has even testified in immigration court multiple times. So the journey began in 2000. He was at Downstate. He conducted the first interview through PHR, and at the time, there were no student-run clinics in the U.S. And it wasn't until 2010 that Columbia University established the first student-run asylum clinic, which became a source of inspiration for the students here at Downstate. And then in 2016, the board of the Brooklyn Free Clinic proposed the idea of starting an asylum clinic. And by 2018, we were able to take on our first client who was successfully granted asylum. And then a year later, in 2019, we formalized our efforts with the Memorandum of Understanding, and the Downstate Asylum Clinic was officially recognized by a national PHR organization. So we can go to the next slide. So what do we do at the Asylum Clinic? So at our Asylum Clinic, we work closely with Physicians for Human Rights and pro bono attorneys to offer medical evaluations for asylum seekers. These evaluations include both physical and psychological assessments that are essential for supporting asylum cases. When we're contacted about a case, our first step is to coordinate with our physician volunteers who are awesome, and then we can start the process from there. So we have a whole team for each case, and it really just ensures the client receives comprehensive care and support throughout the process. Once the evaluation is completed, we have a medical affidavit, and then it gets sent to the attorney, and then we hope for the best. In addition to these evaluations, as of this year, we recently launched a continuity of care clinic to address some of the broader challenges our clients face. And this clinic focuses on issues like food and housing insecurity, as well as mental and physical health. And we're partnering with the Arthur Ashe Institute and hopefully the Brooklyn Free Clinic to connect clients with the resources that they may need beyond medical care. We can go to the next slide. So I just wanted to define some terms. So to start off, refugee refers to any foreign person who is unable or unwilling to return to their home country because of persecution or well-founded fear of persecution. And this could be due to factors like race, religion, nationality, membership in a particular group, or political opinion. Next, we have refugee status seekers. These are individuals who are outside of the United States and apply for refugee status before traveling here, which is different from asylum seekers or asylees, which are people who are already in the United States or at a port of entry when they apply for asylum. So on average, the asylum application process in the United States takes about 6 months, and the demand is high, with tens of thousands of people applying each year, but unfortunately less than 40% are accepted. Go to the next slide. So where do our clients come from? So we solely serve asylum seekers. This year we have had clients from Africa and Central America, and the greatest number come from China, El Salvador, Guatemala, Honduras, Egypt, and Mexico. So just a little map of that. So what is the current situation for those seeking asylum today? Sorry. So on June 4th, President Biden introduced new restrictions on asylum that have added significant limitations to who can apply. A new federal rule now restricts eligibility for migrants crossing the United States-Mexico border, mainly targeting those entering between official ports of entry, which essentially means those who are entering illegally. So asylum seekers are now required to use this new CBP One app to schedule appointments for their application. And even though they say it's intended to help migrants secure an appointment before arriving at the border, it's been criticized for technical issues and the limited availability of slots, leaving people in very unsafe conditions as they wait for their chance to apply. Another significant change is the tightening of screening standards. So it kind of raises the bar for initial asylum screenings to make the process more efficient, but makes it harder for migrants to qualify for protection. And then lastly, there is a new transit country requirement, which restricts asylum eligibility for migrants crossing the US border illegally. And they must prove that they first sought protection in another country that they passed through, like Mexico, which is essentially the transit country, to secure an appointment. So we can go to the next slide. And I'm just going to talk really quickly about the criteria needed to qualify for asylum, which wasn't on the previous slide, but I felt it was important to mention. So being granted asylum is a very complicated, it's a complicated structure, system, because there are a lot of specific things put in place. So there's four criteria really that people need to fall in, which is fear of persecution. So they have a fear of being in their country due to harm. A reason for persecution. So their fear has to be because of specific factors. They can't just be scared. So it could be their race, religion, nationality, political opinion, or membership in a particular social group, which essentially means like people who may oppose gangs, people who are identify as anything other than heterosexual. And the third one is government involvement or action. So the harm or persecution is coming from the government themselves or from groups the government won't control. And lastly, no safe options. They must show that they couldn't safely relocate to another part of their home country to avoid the harm. So in simple terms, asylum seekers essentially have to prove they have a real fear of being harmed because of who they are or what they believe, that their government won't protect them, and that they can't be safe anywhere in their country. So why are these new restrictions and policy changes such an issue? Well, they cause major legal and human rights concerns. So advocacy groups like the National Immigrant Justice Center argue that these policies are violating both United States and international asylum laws because according to international agreements, individuals have the right to seek asylum regardless of how they enter a country. But these new restrictions are obviously trying to limit that right, and many advocacy groups are challenging these cases in court. Another concern is obviously the impact on vulnerable populations. So forcing asylum seekers to remain in their home countries or transit countries often places them in dangerous situations. There's risks of violence, exploitation, abuse, human trafficking, and just disease due to, unsafe living spaces. So the Biden administration says their goal of all these changes was to streamline the immigration system, reduce the strain, and prioritize legal pathways for entry. However, this approach excludes legitimate asylum seekers because a lot of them lack the technology to access the required application tools. So we can go to the next slide. So what can you do to help? So our asylum clinic at Downstate is one of the busiest in the country, and we're dedicated to providing essential medical evaluations for asylum seekers in partnership with Physicians for Human Rights and pro bono attorneys. But despite our best efforts, the demand for evaluation far exceeds our capacity. So currently, we're receiving about 10 to 20 cases every month, but due to limited resources, we're really only able to accommodate one or two, which means we have to operate on a first come, first served basis, leaving many asylum seekers without the timely support that they need. So, to meet their growing demand, we're actively seeking attending physicians who are interested in volunteering. And if you're looking for a meaningful way to make an impact, we have an upcoming training session on November 17th, available both in person and virtually. This session will be led by experienced physicians who will guide you through the process of conducting medical and psychological evaluations, making sure you're fully prepared to manage the cases independently. And if you're unable to attend the live session, we're going to work on make the recording available. But aside from that, there's also an option to complete the training independently through the PHR website if we're unable to share the recording. But I think the live recording, I mean, the live lecture is really great because seasoned physicians who have done a good amount of evaluations will be there and kind of share their experience on how they feel that they made their evaluations most successful. So by volunteering, you'll play a crucial role in supporting individuals seeking protection from persecution, and your involvement really could make a significant difference in their lives. So if any of you are interested, you can scan this QR code or email the PHR at downstate.edu email or my personal email, which is my first name dot my last name at Downstate. And thank you all for listening.
Thank you so much. You did a wonderful job, Sabrina. Great job. Thank you. Thank you.